Welcome to Globe Myst, the channel that uncovers the darkest truths and the hidden crises that shape our world. Today, we're pulling back the curtain on one of the most terrifying realities Americans are facing: the worsening mental health crisis that is expected to peak in 2025. Millions of people silently battle depression, anxiety, schizophrenia, and post-traumatic stress disorder, while the system designed to protect them collapses under pressure. The streets are filled with untreated cases, psychiatric institutions are overwhelmed, and suicide rates are climbing to levels never seen before. Society is crumbling under the weight of neglect, with government policies failing and healthcare becoming more unreachable than ever. Mental illness does not discriminate. It affects students drowning in pressure, veterans haunted by trauma, overworked professionals, and homeless populations who have been abandoned by a failing system. The worst part? 2025 is expected to mark the peak of this catastrophe, where mental illness will consume more lives than anyone predicted. Why has America failed to fix this crisis? What horrifying truths are hidden behind the statistics? And most importantly, what happens next? A crisis that can no longer be ignored. The numbers don't lie. By 2025, America's mental health crisis will reach historic proportions, surpassing previous records in suicide rates, psychiatric admissions, and substance abuse-related deaths. Depression alone will affect nearly 50 million Americans, with young adults suffering the most. The tragic reality is that most of these individuals will struggle to find help, either due to financial constraints, long wait times, or the sheer lack of available professionals. Therapists and psychiatrists are overloaded with patients, unable to meet rising demand, leaving many trapped in their own minds with no escape. A nation known for its advancements in medicine is now facing a psychological epidemic where people are desperate for assistance but unable to find it. Suicide rates will reach alarming heights. The most chilling consequence of the unchecked mental health crisis will be the rise in suicide rates, expected to be higher than ever before. The struggle to afford therapy, the lack of available professionals, and the crushing weight of societal pressure will push thousands of individuals over the edge. Young adults, in particular, will bear the brunt of this tragedy. The illusion of online perfection, social media pressure, and financial instability have created an environment where people feel isolated, lost, and unable to cope. The American healthcare system, instead of stepping up, continues to ignore early warning signs, letting suicidal individuals slip through the cracks without intervention. If urgent action isn't taken, suicide will become one of the leading causes of death in the country, a heartbreaking reality that no government official seems willing to acknowledge. The drug epidemic: how addiction fuels. Mental collapse, substance abuse, and mental illness have long been intertwined, and 2025 will see this deadly relationship spiral even further out of control. The opioid epidemic, largely fueled by pharmaceutical greed, has already cost thousands of lives every year, and experts predict even higher numbers in the coming years. Desperate for relief, individuals are turning to drugs as their last escape, drowning their pain in addiction when therapy and medication are out of reach. Fentanyl, heroin, and synthetic opioids continue to dominate the streets, creating a nationwide emergency that has been ignored for far too long. Pharmaceutical corporations, the very industries responsible for creating addictive drugs, are still profiting while ordinary people die in staggering numbers. The government has failed to regulate their power, allowing them to continue pushing highly addictive substances without addressing recovery solutions. Instead of building rehabilitation centers, lawmakers are increasing incarceration rates, treating addicts like criminals instead of individuals in need of medical help. By 2025, America will experience a surge in overdose deaths, pushing the mental health crisis deeper into catastrophe. If intervention doesn't happen immediately, entire communities will be wiped out by addiction, and the streets will continue to be filled with individuals who have lost everything, including themselves. Homelessness and mental illness, a crisis that's becoming unstoppable. The homelessness crisis in America has become inseparable from mental illness, creating a humanitarian disaster that will peak in 2025. Thousands of untreated schizophrenic and bipolar individuals wander the streets without shelter, medication, or access to psychiatric care. Families are torn apart as evictions surge, forcing more individuals into hopeless situations where they must fight to survive every single day. Without adequate shelters or government assistance, homeless populations will skyrocket to unprecedented numbers. Cities will become chaotic battle zones, flooded with desperate individuals suffering from untreated illnesses. Rising crime, drug abuse, and mental breakdowns will turn major urban areas into unpredictable and unstable environments, proving that America's failure to provide health care has far-reaching consequences. In 2025, the streets will be filled with people society has abandoned, left to navigate the brutal realities of mental instability without guidance. Unless drastic measures are taken, this problem will spiral beyond control, leaving millions in despair. The collapse of America's healthcare system. Healthcare is supposed to serve and heal, but in America, it has become a luxury only the wealthy can afford. The high cost of psychiatric care has prevented countless individuals from receiving life-saving treatment. Insurance companies refuse to cover essential mental health services, forcing patients to either suffer in silence or drown in medical debt. Psychiatrists and therapists are overloaded with cases, often unable to offer appointments for months, leaving people with urgent needs untreated. Instead of prioritizing healthcare reform, the government continues to funnel money into corporate bailouts, defense spending, and tax breaks for billionaires, ignoring the worsening state of public health. Mental illness is not temporary. It is a life-altering condition that requires consistent care. But by 2025, that care will be nearly impossible to access for millions of struggling individuals, creating a crisis that will test the very foundation of society. Final thoughts. The future of America. If nothing changes, the future of mental health in America is terrifying. The crisis will continue escalating. Homelessness will become unmanageable. Addiction will wipe out communities, suicide rates will rise, and healthcare will remain inaccessible to those who need it most. But this does not have to be the future. The only way forward is immediate action. Increased funding for mental health services, rehabilitation programs, addiction recovery efforts, and policy reforms that make psychiatric care accessible to all. Without intervention, the crisis will reach its peak in 2025, and by then, it may already be too late. The time to act is now. This is Globe Myst, where we reveal the dark truths behind global crises. If you believe mental health awareness is important, don't forget to like, share, and subscribe. Change is possible, but only if we demand it.